If I get any weaker, I'll shoot you.
Carotid massage. Slow your heart.
Get the damn paddles, or I'll shoot you.
We can cardiovert chemically. If we don't try something, he's gonna kill someone. I'm gonna get the drugs.
30 seconds.
The patient's heart's going at 200, he's got a gun in his hand, and now 13 has a decision to make. Either she saves herself and leaves to the safety of the SWAT team, or she goes back inside with the drugs and tries to save the rest of the team. Very excited to be reacting to House MD Season 5 Episode 9 Last Resort. On this channel we are reacting to all 177 House videos, and this will be episode 102. Let's see if I can get the diagnosis before House does as a doctor working in London.
I'm consulting on some clinical trials that involve CNS compounds.
While it's true that no sometimes means yes, in this context...
One's a new Huntington's drug.
No thanks.
Excuse me, I'm looking for Dr. Cuddy. Do you know when she'll be back?
Yes, which is why I need you to get out and leave me alone.
Sorry. I'm sick, and I want to know why. I want the best doctor in this hospital here, now, or I'm gonna start killing people. My medical records, I need you to read them. I've been to 16 doctors in the last 2 years. What's missing is an answer. I can't breathe. I get skin rashes, heart palpitations.
What kind of breathing problems?
Sharp pain when I inhale.
And this is exactly why higher management have their offices as far away as physically possible from the urgent care centre. Usually that's behind at least 2 swipe access doors, a lift, and some labyrinth-esque corridors. Also, nothing like a gun to speed up the complaints procedure, although I really hope nobody gets any ideas from this. Now we know the patient had chest pain on deep breathing, skin rashes, heart palpitations, and is tired all the time. So what could this be? No pressure, but if we don't figure it out, someone dies. One really interesting one is pericarditis, which is basically inflammation of the heart scrotum called the pericardium that can cause all of the patient's symptoms, especially if the pain is relieved by sitting forward. Autoimmune conditions like rheumatoid arthritis or lupus can do it as well, or endocrine conditions like severe hyperthyroidism. You could rule in or out many of those with a set of blood tests, a chest x-ray, and ultrasound of the heart. But how can we get any of those done when the man is barricaded with a gun? Maybe the team will have to get more creative with some more old school methods which look like tests but are actually not. Like doing a makeshift ECG with the mains power lines that electrocutes him and earns them their freedom. Let's find out.
Got a match?
Why?
Because I'd rather not stand here while you try and negotiate a hostage trade for an incentive spirometer.
Got a lighter.
It can only be pulmonary scleroderma. Case solved. See you on Visitor's Day.
House, what's going on in there? Is everyone all right?
About to be, assuming he's not lying. I'm gonna need some Propofol to prove that it's pulmonary scleroderma.
You sure?
Have one of the guards bring it in.
No guards. No cops. Give it to someone else first.
You're the only one who needs it.
You think I'm an idiot?
Thought I had a little more time with a guy that size.
I need you. Oh, you can't screw with me.
This is getting spicy. House thought he would have more time, and rightly so, because technically he should have. That's because giving an intramuscular injection actually does take a bit of time to enter the bloodstream and be absorbed. That means 5 to 10 minutes before the magic milk of Propofol makes its way to lights out. With injections straight into the blood, that time window is just 11 seconds. So the reaction here isn't quite accurate from the producers, but I understand why they didn't have 8 minutes for the less stable Leaning Tower of Pisa to activate. Another very important consideration is that Propofol actually can't be given into muscle because it doesn't work and can even kill off part of the muscle it's injected into due to tissue necrosis. The drug is incredibly hydrophobic, which means it doesn't get into the blood well at all, so it ends up staying around where it's injected, leading to the negative effects. We still don't have more clues, but we might have a second patient who needs help. Question for you smart people: how long can someone survive if the bullet pierces their femoral artery? Answers down below, and I'll give it to you at the end of the video.
Lieutenant Bowman, Princeton SWAT.
What causes low lung volume, heart palpitations, fatigue, stomach pain, insomnia, and a rash?
Sounds like chronic lung infection.
Could be a cancer that spread from the lungs.
Could be a heart defect.
We're gonna draw blood. Run tests for infection and cancer. See if any of his past 900 medications could have screwed up his heart. Go to his apartment, check for neurotoxins.
Open that blind. Back the hell out of there now!
Somebody else hear those guys outside?
We have a favorite. It's nerve related.
They found his sonar ears from him hearing the SWAT team outside. Oh, that has to get some serious accuracy points. You see, there is a muscle that dampens what we hear by reducing the response of the delicate bones in the middle ear. The muscle is called the stapedius. If there's nerve damage to the nerve that provides it with function, known as the facial nerve, then you can get hyperacusis or excessively loud, unregulated hearing on one side. What other signs of facial or seventh nerve palsy are there? Well, it generally would cause weakness on the side of the face which is affected, except for the eyebrow. That's because the eyebrow muscles have a backup supply from the second facial nerve on the same side of the head as the weakness, rather than the one that comes from the opposite side. This patient doesn't have that though, so is it still possible? Well, yes, because the whole of the nerve doesn't need to be damaged, only a small part of it could be, or a spot in the brain that it originates from. There are a few things that could cause this, like a stroke, neurotoxins, MS, brain infections, or HIV. That does make pericarditis less likely, so I'm glad I didn't use a diagnostic guess on it. Let's see what they find.
A big mugshot smile. It's post-herpetic neuralgia. I'll order up the tests. If you have neuralgia, you won't feel it going in.
You're gonna send in...
Capsaicin, 200 micrograms.
You gotta give us a hostage.
You can have two. Who's taking the first dose?
I'll do it.
This is a level of risk-taking beyond anonymous girl-on-girl action.
They're patients. I'm a doctor.
Your turn.
Couldn't focus.
You must have $7,000 in unpaid medical bills. If you've got millions of people thousands of dollars in debt because they're sick, at least one of them's gonna do something inexcusable.
White blood cell counts normal.
Found a picture of his mom. She's got a droopy eye, fat face, thick neck.
Classic signs of an upper lobe tumor.
He needs to check your pulse.
It's racing. 160.
If I get any weaker, I'll shoot you.
Carotid massage.
Slow your heart.
Get the damn paddles, or I'll shoot you.
We can cardiovert chemically. If we don't try something, he's gonna kill someone. I'm gonna get the drugs.
30 seconds.
The patient's heart's going at 200, he's got a gun in his hand, and now 13 has a decision to make. Either she saves herself and leaves to the safety of the SWAT team, or she goes back inside with the drug and tries to save the rest of the team. Now, she already sacrificed herself once by choosing to take the capsaicin injection, which is essentially the active ingredient in chilies. Would you let someone inject you with hyper-concentrated chili? It sounds like more fun to watch the Barbie movie all the way through. Believe it or not though, capsaicin from chilies is actually used as a treatment for nerve pain, but why is that? Well, it overloads the nerves with heat signals, stopping the pain signals from getting to the brain instead. That can be rubbed onto the affected area as a cream, but it can also be injected by pain specialists into the nerve roots themselves for longer acting pain relief. House thought if the patient's nerve was damaged from herpes, he wouldn't be able to feel it, but it turns out he could, which is why it was crossed off the board. That seems like ancient history at this point now though. So what is 13 getting to sort out the patient's heart stuck on 3x speed? It's likely a drug called adenosine or amiodarone. 300 milligrams of amiodarone into the vein helps to act on the AV node to slow down the signals from the top of the heart reaching the bottom of the heart. You've got to be careful with this drug though, as especially if you use it with beta blockers, it can actually slow down the heart way too much. A normal heart rate is 60 to 100, and I once had a patient on both amiodarone and beta blockers whose heart rate ended up dropping to 35. We had to start externally pacing him, which is basically multiple small electrocutions until he got a temporary pacemaker put in. Why don't the team just shock him though, as this patient's heart is going fast, not slow? Well, he's holding a gun, and anyone who's seen a movie Electrocution knows that electricity causes muscles to contract. In fact, our nerves were the original wires that use small electric currents to control basically everything we do. Either way, getting a man with an itchy finger attached to a gun to start contracting isn't exactly the safest plan for those around him. If his heart carries on at this level for much longer though, he may not be conscious enough to squeeze the trigger finger himself anyway, but I'm itching to find out.
She's gonna come back.
You should go.
Is that your version of morality?
If you don't think your life is worth more than someone else's, sign your donor card and kill yourself.
No! She just needs time to get me!
She takes everything I take. I don't want anything that cross-reacts.
Heart's back to normal. You're sweating one side of your face, but not the other. You have lung cancer.
Lung cancer usually shows up lower than the seventh nerve. You check his throat?
Spit on the floor. Dry mouth.
If it's cancer, there must be a test.
You hate doctors. You want to take back control.
I just want an answer. Anyone moves, I fire.
If you want your answer, you got to give me the gun.
Starburst artifact. The metal from the gun is ruining the image.
House got him to give up his gun. We just ran.
Why are you still here?
Curious.
They're gonna be through that door any moment. Just show me the tumor.
There isn't one.
It's over. Thanks for trying.
What are my eyes witnessing? I've seen House do some outlandish things. Infect his teammate with Legionella, blackmail his dean of medicine for a TV, and get Wilson arrested by stepping on his accelerator while going past the cops. None of them have put as many people in danger as this moment, giving a gun back to a kidnapper. Why did he do that? Well, he's been trying to dig into the mind of the man for the whole episode and has discovered that he's never been married, isn't overly attached to his work or other material objects, and simply needs an answer because he wants to know. House can relate to that since that's basically what motivates him as well, even after a patient has died. We did have some extra clues, including that the patient's blood tests were negative, so was the CT and capsaicin test, and the patient was only sweating from one side of his face with a dry mouth. It sounds like he has something called Horner's syndrome, but what even is that? It's when the nerves that control the fight or flight response on one side of the face have been damaged, usually from something known as the sympathetic chain. You see the nerves that control this process come out from the spinal cord and go up into the head. On their journey to the great upstairs, they may encounter some challenges along the way. There could be a lung cancer, other tumors, swollen lymph glands like in a lymphoma, or a very interesting one which is swollen aorta. You see, the patient could in theory have a condition called Takayasu's arteritis, which is much less tasty than it sounds. It's a type of large vessel vasculitis where the body starts attacking the main pipe from your heart known as the aorta. The damage caused weakens the vessel, and since arteries are much more elastic than steel pipes, they start stretching as the high pressure from within the heart gets transmitted to the aorta. This ballooning is also called an aneurysm, and steroids are needed to stop the damage while surgery is needed to repair the affected vessels. The condition has an interesting backstory though, as Mikito Takayasu was a Japanese ophthalmologist that first discovered it back in 1908 when he noticed an abnormal pattern of the vessels of the eye that was associated with no pulse being felt at the wrist. It was then realized once diagnostic methods improved that this was a vasculitis that could affect other parts of the body. Madness what doctors of the past had to go through. In a way, it does take some of the challenge out of medicine having all of this modern diagnostic equipment, but of course it makes it better for the patients, which is ultimately what it's all about, even though the puzzle is also quite interesting.
Maybe no one can cure me.
You're so afraid of being ordinary, of being just another doctor, just another human being, that you'll risk other people's lives.
Mike the door. Hope your boyfriend knows what he's doing.
He's turning his head, favoring his left ear. Which means he's partially deaf in the right.
Cushing's causes fatigue, fluctuating hearing.
Even increased aggression and risk taking.
I need Dexamethasone.
Give it to her first.
Why would I do that? I give you back the gun.
You wouldn't.
Don't do
Heart's racing, and your breathing's unchanged. Means I was wrong. Her kidneys are shutting down because of the meds you made her take. The twitch is Vostek's sign.
If 13 spontaneously injects herself with any more random needles, her name will need a recount. The dexamethasone she now injected herself with seems to have done some damage to her kidneys very quickly, which doesn't quite make sense. There are at least two reasons for this. Dexamethasone actually has the longest half-life of any synthetic steroids in use, which means it takes a long time to work. That's evidenced because the test House is trying to emulate actually has a 9-hour gap between administration and the reaction that we usually detect on the blood test. Secondly, steroids like dexamethasone are actually used as a treatment for some kidney-related conditions and can improve kidney function rather than causing a meltdown worse than the US Senate questioning CEOs.
And I served my military for two and a half years in Singapore.
Do you have any other passports from any other nations?
No, Senator.
Have you ever been a member of the Chinese Communist Party?
Senator, I'm Singaporean. No.
Now we have a major clue. Chvostek's sign, I am twitching with excitement. Not only because it was very satisfying seeing House slap our captor, but also that the twitch is a sign of low calcium levels in the blood. The actual sign can be elicited just by tapping on the jaw, but that doesn't quite send a message as much as a full-blown slap. It's traditionally called tetany because when calcium levels get critically low, it can actually cause your whole body to start contracting, leading to a dreadful condition called opisthotonus, which looks similar to getting tetanus. The most common cause of low calcium is low parathyroid hormone that could be related to surgery or kidney disease in the patient, but none of that was in the history. It could also be medication related, but that wouldn't be quite so spicy. Other than overt surgery, the parathyroid glands can get damaged another way. Addison's disease. It's an autoimmune condition that usually affects the adrenal glands, reducing cortisol produced from there. It can lead to skin rashes, fatigue, palpitations because of low calcium, and basically all of the patient's symptoms. Ironically, the dexamethasone wouldn't act as a test, but could make the patient feel better rather than worse. It would fit really well and has to be my diagnostic guess. In the real world, it'd be easy to diagnose with a short synextin test, but who knows where the wind will take us here.
He has calcium deficiency.
He's been on protein pump inhibitors for years. For his stomach pain.
Those drugs have been protecting his kidneys for years.
Melioidosis. It explains everything.
Now that our patient has never been to a tropical climate.
Ever been anywhere south of Florida? Florida counts?
Blaming doctors. Can't even give a halfway decent history. You get us 3 grams of ceftazidime.
You can have Dr. House.
You're gonna give her the meds.
Combination of meds could knock me out.
Your obsession is gonna kill her.
Your obsession gave me back the gun.
I don't want to die.
Why are you still alive?
He didn't make me take it.
Your kidneys will be okay.
About that Huntington's drug trial.
Tests confirmed melioidosis. Easy to miss on the stain.
This is why you and I can't be a thing.
Melioidosis! Oh, that is some niche infectious disease territory, and House didn't even come up with the diagnosis. It was Cameron. I have to admit, I had to look this one up because there have only been around 4 cases a year in the whole of the UK between 2010 and 2019. It's caused by a bacteria called Burkholderia pseudomallei, which enters the body through breaks in the skin, breathing, or eating. It can cause anything from no symptoms to full-blown pneumonia with sepsis and abscesses, and non-specific symptoms like our patient has. Diabetes makes getting the condition more likely, and the chance of dying in a developed country is 10%, but in a place with poor health infrastructure, it's more like 40%. Modern medicine does work, people, although presumably you're watching this because you think that too. Also very interested to see how this romance between House and Cuddy plays out. Really loved this episode. 8.5 out of 10 entertainment, 6.5 out of 10 accuracy as a reaction to Dexamethasone with 13 was sketchy at best, and 8 out of 10 diagnosis. If a bullet hits your femoral artery without adequate compression or surgery, a person would bleed out in only 3 to 5 minutes. This episode only makes full sense when you watch the previous one where a young girl pretends to have no parents here.